Hello guys, Dr. Eric here. I'm glad that the day is finally here. For those who have been following me, we had planned that from the 5th of August to the 15th of August we'll be here in Arawa, basically to conduct circumcision, the smart way, the modern way, the advanced way. So the day has finally arrived and we are happy. We're in this beautiful hospital, very beautiful. Those of you who have never heard of Arawa, right in the middle of Bamburi, Karibu Kwalai, for those who know where Kwalai is, it's a very beautiful place. I'm in the first floor. This is the female ward. And there is a maternity ward there. Very beautiful. And we chose this place basically because of the high levels of hygiene. You know, when you want to do your surgeries, when you want to do your procedures, you need a place where infection prevention is of paramount importance, and this is a very clean place. It's very wonderful. Maternity ward, yes, male, female. That's where the theater is. I'll show you. That's where we'll be working from. There is a minor theater inside, but we'll come to that place. We'll come to that place later, but first of all, let me show you how the ground floor looks like. That's where the outpatient department is for the walk-in clients. Let me show you. This is where the dialysis is. It should be here. That's the laboratory. This is the pediatric ward. You can see. Very beautiful place. Very beautiful place. That's the pediatric ward. If you have a sick child, this is a very nice place to bring them. I love the paintings in the walls. That's where the HDU is. I think there are some clients here. I will not go past that point. This is the first floor. Sorry, I was in the second floor. So this is the first floor. And then there is the ground floor. That's our Costa Pharmacy. So this is the nursing station. Very beautiful place. That's where the patients are being triaged before they see the doctor. Very nice place. This is the MCH. Where mothers bring their babies to be weighed, vaccinations and all those things. Maybe Antinatal Clinic. This is a play area, probably for the kids. This hospital is very beautiful. If you're in Mombasa and you've never visited Arawa, I don't know what your problem is. You should visit this place. At least sample their services. There's a number of insurances that they accept. Let me show you. There is SHA and these other insurances. So that's it. That's the ground floor where everything is taking place. That's the outpatient department. Let's go back to the theater. There are a rainbow of possibilities. Make every day count. I love that. So this is the lab. Beatrice is there. She does her thing in here. As you can see, it's well equipped. Most tests are done here, so you don't have to worry about going out there. And the place is spacious, so I love space. Aya Beatrice, thanks. Nimemaliza. Back to the theater. This is the theater. This is the main theater. So this is where we'll be doing our thing. This is the place where the patients are wheeled in. And this is where the staff goes through. Strict infection prevention protocols. I have to leave my shoes out there. If you've been in a theater, that's the CSSD, where sterilization of instruments takes place. This is the boardroom. Penye nurses huwa wanapiga moshene. Yes. That's where the records are done. You can see the scrubs and all these things. These are the changing rooms, gents and ladies. This place is nice, very nice. The theater is fully equipped, and I love the outline. Whoever did this knew what he was doing. This is the main theater. This is the main theater. It's fully equipped. I've actually seen the records of this hospital, the theater records, and a lot of surgeries go on here every single day. So if you are planning, if you are in this place, this environment, and you want to maybe do you have an elective cesarean section, even emergency CS, and all these other surgeries, this is the place. Very equipped, very clean, very nice. Now, that's the scrubbing area where we wash our hands before going in. This is the scrubbing area. For scrubbing, they use that to do. This is, I believe this is the observation area, you know, probably after the patient is from the theater. And now, this is the minor theater. Let me switch on the lights. This is the minor theater where we'll be doing our things, as you can see. Already we have our packs ready. This is our light. Though with the kind of surgery, the kind of circumcision that we do, we don't need much light, but that's good. At least we are ready for that. It's a very clean area and it's very spacious. And one thing, this is one of the reasons why we chose this hospital, because this minor theater is very spacious. And in a minor theater, we can actually allow one of the parents to come in, maybe the father, at least for emotional support for those small boys, because this is not like the main theater where the infection prevention protocol is 100% here. Actually, one guardian can come in, we can give him some gear to change for the emotional support of the boy, because the boys, we are using local anesthesia. We're not using that machine. This machine, I believe it's for general anesthesia. We're not using that. Some may ask, why is it there? We are not using general anesthesia. Ours is local. We want to maintain the masculinity of men in Africa. At least some people are telling me that the boys at least should experience some pain kidogo, because I've said the pain is minimal. And the pain is minimal simply because the stapler does this thing first. It cuts and it stitches. It installs the biodegradable staplers. So by the time, imagine it like how they use a gun to pierce the ears. Speed usually plays a very big role in pain management. Although we use local anesthesia, so most of the time they'll be comfortable. Once the local anesthesia starts wearing out, they'll start to feel some pain, which usually we manage with the common painkillers, brufen, paracetamol. After the first day, they are good, they are okay. So that's the advantage with this procedure that we do. So we are actually expecting some clients to come in today, and I believe I'll be able to do a video of how the procedure goes. At least so that you can understand how this thing is done. And another thing, we don't just do it in a theater setting. The procedure is minimally invasive. By minimally invasive, I mean the instruments that we use, like these ones, are purely for holding the foreskin in place so that at least we can position the stapler. So we don't use these instruments to do the cutting. They don't interact with the wound. Our hands don't interact with the wound. So that's a minimally invasive procedure. And the good thing with minimally invasive procedures is infection prevention. Mostly the main factor is infection prevention. The other minimally invasive procedures which are done nowadays in the main theater, like laparoscopy. This place, I know they are doing laparoscopies. Minimally invasive. They make small incisions. It's not like kitambo where they just cut the whole thing open alafu unaanza kushonwa kama gunia. Nowadays, things are changing. Surgeries are advancing, including ours. Let me show you how the stapler looks like. This is the stapler. This is size 30. It is sterilized by ethylene oxide. And you see the shelf life. The shelf life is long. The sterilization was done, actually it was done last month, and it's valid up to 2028. That's like 3 years. Size 30 is for like boys from around the age of 18 years and above. Size 30. Usually we have around 6 to 7 different sizes, from size 12 to around size 34. And usually this staplers, they go, we call it we say size for every age. So this is how the stapler looks like. As you can see, it's more of like transparent, so that you can see how the procedure, how whatever the cutting goes in there. And it's disposable. Once we use it, it cannot be used again. Again, another factor promoting infection prevention. You can't reuse it. In here, we have staplers that are loaded, and you see this red thing, this one and this one. They are like protection clips, so that if you try to squeeze it before you remove them, it can't work. So these ones are to protect the staplers while they are still inside. So once we do the surgery, we have to remove this, and I think I'll do a video to show you how it really works once we have a client and we have the consent in place. So as I had said earlier, the advantage with this method is very fast and effective. We just need to position the foreskin on this thing. I'll make sure I do another video to at least demonstrate how it works. Once you position the foreskin, you use these handles to fire it's just squeezing. Someone will misunderstand me when I say firing, but we call it firing. When you squeeze these handles, it fires the staplers, and it also at the same time the blade cuts the foreskin. So the staplers which are in there, they join the inner foreskin and the outer foreskin together, and it leaves a very clean and uniform cut all around. Sometimes if you want to, you can reach out. I can share some of the photos for you to see. So, things are advancing, and people are embracing this. Nowadays, I hear that the African tradition is really, fading a little bit, because there are some hospitals which do circumcisions and general anesthesia, and I'm not disputing in any way, because circumcision purely is a consent thing. Whatever the parent wants for the child, then that's what they'll get. But for me, I really don't advocate for general anesthesia. This stapler makes everything simple. So it takes around 5 to 10 minutes. So a local anesthesia usually does the trick very well. Most of the kids that we've circumcised, like 5 years, and from 5 years, 4 years, 3 years, they're usually comfortable all along. Once the only discomfort that they experience is when you're administering the local anesthesia. That's where, but most of the time it's because of the fear of needles and all that. Once the local anesthesia sets in, they don't feel anything. By the time they start feeling some pinch, the procedure is already done. We've already dressed the wound, and usually at this time we can just manage the whole thing with the analgesics, common analgesics, brufen, paracetamol, and all that. So Personally, I will advocate for this method. Some say it's a little bit costly, but many say that well, it's worth the price. It's really worth the price because it's fast. It has a lot of the advantages compared to the traditional method. So if you're out there, and actually we are having adults who are reaching out to us, and this is a good thing because most of them will want to maintain their privacy, you know. And this is actually the one of the best methods because you see, in a home setting, it works very fine. And with adults, they are not as stubborn as little children, so it makes it even more faster. And recovery times are quick. So within a week or so, if you're an adult, you are able to go back to your workplace. You are able to do your thing, your not nini, not marital duties. That one we advise them to stay at least for like at least 3 weeks or so when the staplers have fallen off. Because we've had cases where others want to remove them before their time because they see that like they are missing out on something. So we don't advise the staplers to be removed. Usually they have, I'll demonstrate this in our next video. I'll demonstrate it. I'll show you how this goes. So we usually advise them to leave the staplers to fall off on their own, and give it some time, 3 weeks or so, they're able to resume to their normal marital duties. But work schedule, you can actually resume after a week or so. And this is good. So if you're an adult and you think this is the best method, reach out to us. We'll come to you. We'll organize. If you want it in a setting like this, we are able to organize where you are. Like for the people of Mombasa, we've organized it in this hospital. And we have many bookings coming in, especially for December. So December will be a little bit packed. So this is the best season. If you've been considering this, don't procrastinate anymore. Nothing to fear. Just make that decision, and we'll be able to do this as fast as possible. So I urge people to make up their minds and let's do this. Let's give you the service. We'll talk more. If you have any queries, any questions, any clarifications, kindly reach out to us. We have our website, www.circumsmartafrica.com. Then we have our phone number there. You can reach out via WhatsApp. You can reach out via Facebook. Any place that you want to reach out to us from, kindly do. We are here to help you prepare for this psychologically. For boys for as little as 2 years of age, and even adults up to 65 plus years. We have, I didn't show you this, we have a measuring card. This is the measuring card, as you can see. These are how many sizes? 9 sizes. The smallest one is size 12. We have 14, 16. So many of our clients fall at this level between 18 and 22. Most clients fall between these sizes. And these ones from here, usually for bigger boys and adults. The biggest size is 34 millimeters. And that is for adults. So we have many of these cards in store. So maybe you want to check out your size, the size of your son. Usually we just advise you, like, let's say this is the penis, it should just fit, not too tight, not too loose, you see. Like now this finger falls on size 18. So that's how you measure. It's just as simple as that. And you are able to know your size beforehand. So reach out to us. That's it for this video. We'll be doing more videos to explain how the procedure goes and how everything works. And remember to, you can subscribe, you can share this video. I know you know someone that knows someone. Share this video. Let's work together. And I'll be sharing so many other things, including our vision, our mission, and what we are here for. We're not just here to make money. We also want to create an impact in our society, especially things to do with the masculinity of our young men. Our generations are, the things are really changing as fast as our world is changing. So we actually need to maintain certain values in our society, especially here in Africa. So we'll talk more. Subscribe and share this video. Thank you very much for your time, and have a good day.